Core breathing. Core breathing to get the thoracic diaphragm to move well, so that your inner abdominals can work well, your internal obliques, and your multifidus, low back muscles supporting your spine. And as a secondary to that, your pelvic floor diaphragm. Without this main system working well, anything secondary to that will never work well. So this is really important to get your breathing system right and your ability to produce intra-abdominal pressure. So this is a good position to do it in. I could have my feet on a wall, I could have my feet on the floor, but in this position, it's a great way to just notice the curve in your low back and have your low back off. So I've got something underneath my head just to help me have my chin tucked in and my ribs down. If you don't need something under your head, that's fine. I'm trying to have my chest wide, and I'm going to put my hands on my rib cage first of all. Before I get started, I want to feel that my heels are only slightly rested on the chair and that I have a curve under my low back. So just see that you can get your fingertips underneath your low spine, and if you can't, you need to make a curve there, but make sure your ribs are down. You should have a right angle at your hips and a right angle at your knees. We're going to practice breathing through all the different parts of our core, first of all. So first of all, I'm just trying to notice my ribcage breathing. So I want to expand and contract my ribcage as I breathe in and out. And also notice the sides of your ribcage. Next, we're going to move to the belly. And we want a nice doming and a long breath out. Remember to breathe in through your nose and out through your nose or mouth. Nose is better. Try and breathe into the sides of your belly. And if you've got a tight diaphragm, which I noticed you had a tight diaphragm, you need to massage that part of it. So remember, as you breathe in, and then as you breathe out, your fingertips go in and up under your rib cage at the place where your diaphragm is tight. And then as you breathe in, it pushes your fingers out. And then move to another tight spot. Also, you could also then feel where you might have a scar on your abdomen, so a C-section scar or an appendix scar. Massage that area now at this point just to help force transfer through into your whole core. It will also limit your pelvic floor movement if you have an episiotomy scar. So the same thing, you can massage that area lightly now. So you're just doing circular motion each way on your scar, just nice and gently. It can be through clothes or can be on it, it can be with oil or can be without. And then see how that affects the ballooning you can get, the doming you can get in your belly. And now I'm going to put 2 fingers on either side of my pubic bone, and just where it's slightly squishy above the pubic bone, so either side, so I'm there. And I'm just putting my fingers there and putting a little bit of pressure on. And I want that area to move. So I'm trying to breathe into those points. So all the rest is moving, and it's also filling my pelvis, my breath. So do that for about 6 breaths, trying to breathe deep into your pelvis, or more is better. And then I'm going to do some transverse abdominis activations. So once I've done all of that, and I've massaged, and I've released my diaphragm, then on a breath out, I'm going to lift one heel off and just put it down, just on the same breath out. So I'm going to breathe in, and as I breathe out, and I want my back shape to stay the same, and you'll notice that I started the out breath before I lifted the leg, and I had the leg down before I finished that out breath. So do 3 of those on each leg. You don't want to do masses more. If you do, you could do 5, but no need to do any more than that. What this is a repatterning and an activation of muscles that should work naturally, reflexively, but aren't, because of limitations within this system. So we're just teaching our body to work around those limitations, work through those limitations and fix those limitations, which are diaphragm tightness, scarring in this area, and an inability to fill.